Sickle cell pain occurs when your child's red blood cells change shape or sickle. During a crisis, the red blood cells change from round, soft, and slippery to C-shaped, hard, and sticky. When red blood cells begin to sickle, they stick to the inside of blood vessels and cause a blockage. Pain occurs because the tissue beyond the blockage can't get the oxygen it needs. Sickling can happen anywhere in the body.
What causes red blood cells to sickle?
Any type of infection, like a cold or the flu, fever, dehydration, lack of oxygen due to something like asthma, temperature changes in the weather, stress or anxiety may cause sickling.
What are symptoms of a pain crisis?
Your child may be fussy and crying, have decreased movement, swelling, redness, be warm to the touch, or have pain when touched.
What should I do if my child has pain?
Step 1. Check your child's temperature to make sure there is no fever. If your child has fever of 101 degrees or higher, you should go right away to your healthcare provider or to the closest emergency room. Step 2. Determine if your child is having mild pain or severe pain. Make sure your child is drinking plenty of fluids by mouth during a pain crisis. If the pain is mild, you may give your child a dose of Tylenol. 3 hours later, you can give a dose of Motrin or Advil. Check the package for the correct dose. You can continue to alternate these medications every 3 hours until the mild pain improves. If the pain is severe or does not respond to Tylenol and Motrin or Advil, we recommend that you give your child his or her prescription opioid pain medication. Alternate this prescription opioid medication every 3 hours with Motrin or Advil, not Tylenol, until the pain improves. We recommend that you try to manage pain at home with opioid pain medication and Motrin or Advil for 12 to 24 hours before taking the next step. If the pain does not respond to opioid pain medication and Motrin or Advil, or if your child develops trouble breathing or has fever, you should take your child to the closest emergency room.
What should I expect at the emergency room?
Tell the healthcare provider that your child has sickle cell disease and pain. Your child will probably get IV fluids and pain medications. If the pain is not improved with IV medication in the emergency room, your child will likely be admitted to the hospital.
What should I expect if my child is admitted into the hospital?
Your child will continue to receive IV pain medications and possibly IV fluids until the pain has improved. Some children may need a blood transfusion during the hospital stay. You can be discharged from the hospital when your child can keep the pain under control by taking pain medications by mouth. These will be the same pain medications that you can give your child at home.
What should I expect once my child is discharged to go home?
The goal of being admitted at the hospital is to get your child to a level of pain that can be managed at home with pain medications that your child takes by mouth. It may take several days before the pain goes away completely once you are home. Continue your pain medications at home as directed by your healthcare provider until the pain completely goes away.
Thank you. This is very helpful information.